Good afternoon, Dr. Sharma, and welcome to another session on mental health.
Oh, good afternoon, Dr. Vasquez. Good to be back with you.
Dr. Sharma, we recently saw a 6-year-old student take a firearm to school and shoot the teacher. And my question for you today, especially for parents with young children, what are some intrinsic factors in the brain which causes a young person to lose control?
Well, it's really grievous to hear this occurrence again, and at such a young age that we hear somebody perpetrated such a grievous crime. However, we don't know the facts, so we don't make a judgment call, but we can say that there are factors in the brain that can provoke persons to violence, even from very young times. And those are genetic factors, as we talked about before, factors that are what we call neurobiological, in terms of structural abnormalities in the brain. So the brain itself may have some reaction to a metabolic insult, a reaction to a chemical or a neurotoxin that makes it go out of control. So one can be sure as to what exactly happened in that situation, but these are factors that we would consider, whether somebody had access to a drug that they inadvertently took. So those are some of the biological factors that can be looked at in detail. I think today we want to look more at the impact of environmental factors, which would cause the brain itself to change. And it's very common. So I thought today we should look at maybe the influence of social and environmental stimulation, in particular, the impact of the media, the social media, and the exposure to electrical signals coming from cell phones and television.
Doc, with regard, and this I do not know if it's a fact, but it just appears that young men or males in general appear to be more violent than females. Does gender play a role?
Oh, absolutely. More violence is perpetrated by males, especially the older males. The testosterone factor will start to kick in. So that's a definite yes to that. And in terms of childhood disorders, in terms of prevalence, we see more prevalence of childhood disorders in males. So there is a preponderance tendency to males. The genetic structure also could be a factor, the biological structure of the brain. We're talking intrinsic factors. I want to go back to the particular one that we're seeing very common these days, which is the role of social media on the brain. And there's a lot of studies done on the influence of violent movies and televisions, and there's always a bit of a argument for and against that point that these influences can change the brain patterns. There are many studies that actually show that there is some conditioning effect that happens when children are exposed to those type of media where there's violence, or even playing games, So we must look at that in terms of the impact and change it. But what we're seeing a lot now is the fact that young people are using the cell phone, almost like if it's an appendix to their body, it's an adjacent limb, that they must see this phone or they lose their sense of comfort and peace, that it takes them away from the social reality of life and puts them into an artificial world. Well, that may be comforting, but at the same time, there's a price to pay for it, because the electrical signals are visual and they're very rapidly absorbed by the brain versus, say, a child reading a book, where the signals are more auditory and gives the time for the brain to listen to the voice of the reader, even the voice of the person who's reading. It takes a while for it to be absorbed and move towards the understanding centers, whereas the visual signals, where they look at this phone and they get an instant stimulation, causes significant hyperarousal of the brain. It's almost like, you could put it crudely, it's like a cocaine fix very quickly happening instantly over and over and over. And many a time when the child is removed from that phone or the stimulation of it, they sort of experience a crash where they start to feel very moody and irritable and demotivated. I actually had one little girl who was not allowed to use her phone because she had a seizure. And she went into this very strange zone of moodiness and detachment. There's extreme reactions to hyperarousal from the brain stimulation. And I don't think we are seriously looking at it as a problem. And it even became a greater problem during the time of COVID, where a lot of youngsters were using the phones and they're using it to study, which was good, but then it became a part of their life because they were not in the social setting of school. And so those are some of the significant issues we see with hyperstimulation or hyperarousal, which is electric, and the withdrawal effects causing irritability and hyperarousal and almost sometimes depression that these kids would feel. So impacting on the brain, could that be a significant cause for children to be moody and irritable? It does seem so, Doc.
Well, Doc, as usual, it is such a blessing to have you address important matters with regard to brain health, and especially with our young children. We are thankful for your dedication and commitment to helping humanity, and especially in the context of Guyana. God bless you. Any final thoughts?
Well, I want to thank you again for your commitment to preventing violence and that we can promote an understanding of good techniques and good habits and good behaviors. It takes an effort, and you're making that effort, and we are hoping that it will pay off. We'll see more safer society, more caring society, more socially connected society. Those are some of the things that are not happening anymore. And it's a change from the way, life should be. We want it to be that way, that people are connected, they're socially cohesive, there is good communication. And I think the next time we're talking, we will talk more about the impact of parental communication and how it affects the child's functioning and how the brain reacts to parents when they're not in cohesion, when there's parental conflict. So thank you again for having me, and look forward to being back with you.
Thank you, Doc. God bless you.